So I'm Carlos. I'm one of the authors of this new topic about basic education of in the classroom for graduates of healthcare. In this case, psychologists and also the doctors from Peru. Basically, we are comparing two variables: the learning self-regulation and resilience. In this study, it was a 100 case study with different professionals from psychology and also medicine when they were graduated most of them after 2020. In this case, we try to compare two type of scales that were both of them validated in a population as the Peruvian. One is a learning self-regulation scale, and the other one is a resilience scale. Both of them basically what we did is to try to compare the results in both populations, applying these questionnaires to these 100 people, and try to figure out how are the correlations in between both scales. In this case, we have the learning self-regulation is also composed by two other variables or subvariables. One is autonomy, and the other one is control. When we saw, what we did is basically we did a convenience type of survey with a snowball type of methodology for collecting different different participators. And at the end, what we did was a statistical analysis in between the results of both surveys. In this case, we saw that autonomy and basically self-regulation and resilience per se didn't have like a correlation in between both of them when we did the statistical analysis. But when we did an inferential analysis in between the autonomy and also resilience, we saw different autonomy and resilience. We saw a different result, that it was correlated in between both of them. When we saw also that when we compared the control and the resilience, there was no comparison in between them, or there was no correlation, sorry, in between both variables. This is a new case or a novel case due to the fact that we have not applied those variables or studied those variables in that much in healthcare professionals. Moreover, in people that is already graduated, most of the studies were applied in people that was in a formation or during the classrooms. The novelty of this type of study is that when we see that the professionals, so most of them, they are out there in the field, they're already practicing, they're already doing their job, but at the same time, they kind of use or continue their education in different levels. It could be residency, it could be postgraduate studies, or other type of postgraduate studies. And sometimes we forget that those people are already like have their own like type of personality form. They have their own tools to try to face these new challenges in education. And so sometimes we try to just or as most of the studies just study those that are information, but we don't see those that are already outside there trying to continue their education in higher levels. It seems to be in this case that we see different results than those that are information. Usually information, there's a correlation, or some of the studies suggest that there's a correlation between the whole self-regulation and also the resilience, as it could be logical, where those who have more resilience probably have better self-regulation of the learning. In this case, it seems to be that the subject of control, or the subscale of control in the self-regulation, it doesn't seem to be correlated by different reasons that we try to elucidate in the discussion of this article. And basically, one of the things is that they already have the tools, or they already have the autonomy, or the other part, also other subscale, more prevalent, or more have more weight than maybe the part of control that is more correlated in how we control our studies, how we use the tools that we have in the classroom to try to learn. In this case, when they are already in the field, they already develop their own autonomy, and that seems to be enough, or seems to be compensating the other part, where maybe the control, the preoccupation of being in a classroom and achieving better grades, or controlling their learning environment, seems to be something secondary when they are facing the self-regulation. This goes with some theories that some authors, or other doctors like Glittel, were proposing, that in this case, the doctors or psychologists or healthcare professionals sometimes tend to develop more their autonomy, and they are fighting more for their autonomy in the field, and tend to be someone that is already, or has already overpassed several challenges during the formation, where they are tend to have like more correlation between the development of their autonomy and how they face their life in general. In this case, how they face the new things that comes, and the resilience, and we can get a little bit of the why the resilience and the autonomy could be correlated in this matter. There are some other sub analyses that practically didn't show anything specific, but we think that this could be correlated with the fact that this study doesn't have a like big power; it's just 100 people by convenience. They are really representative because they are from more than 14 universities, or graduated from more than 14 universities of Peru, in between private and public schools. It can be kind of extrapolated in the Peruvian population, but it will be nice to try to correlate that not only with the Peruvian experience, but also maybe in the more other countries, or Latin American countries, and why not also in other countries like the US, for example, or Europe, or other parts of Asia. So the idea is that when we have more data about this, maybe we can like try in the future to focus how we are going to orientate the basically basically education in postgraduate students, and those who already are in the field and already develop their own type of basically their own type of learning, or self-regulation the learning. Maybe the control and the other parts are not something that they are going to impact that much in their self-regulation, but if we try to develop this maybe skills or tools in the classrooms that can help them to even develop or show their autonomy, probably the self-regulation will improve also, and they will have a better experience in the classrooms as graduates of healthcare already. Of course, as I said, this study has some limitations due to the fact of the population. But we see something that is really rich in this case, is that the fact that it's one of the first times that we are correlating both variables, and if there are outside some other authors that can correlate or use the same variables or similar type of scales. In this case, the empathy work for Walding and Young, basically the resilience, sorry, the Walding and Young, they can also do the same type of studies. In this case, correlating both variables and trying to figure out if this same experience also repeat in other countries, then maybe they have like another type of even experience during the pandemic, for example, that most of these people is out after 2020. Most of them, they have already passed through a lot of things. Maybe this could correlate or be different in people that were related before. We don't know. We already are biased, but maybe you can continue repeating this study. Why not in some years with another situations where the resilience is also developing in a different way? We can apply this study again. There are some other options out there that we can recreate this study in the future. Basically, it's also part of the recommendation that we have. I think this is a really, really great way to see a population that we are not usually studying. We are usually studying both all of them that are in information, that are in undergrad. But sometimes, or most of, we forget that most of these graduates, they usually continue their studies after postgraduate and continue to need the skills, to need to develop these tools for their own education, and that way that they see the education basically. Thank you very much for listening to me. I don't know if you have any questions. Feel free to ask. Thank you.